Hello and welcome to Pregnancy Info. During pregnancy, many women are advised bed rest by their doctors. But have you ever wondered why it is recommended and in which cases it becomes truly necessary? In today's video, we will explore the 12 major reasons for bed rest and pregnancy and explain how long it is usually needed in each situation. Number 1. Preterm labor or early contractions. One of the most common reasons doctors suggest bed rest during pregnancy is preterm labor. This happens when the uterus starts contracting before 37 weeks of pregnancy, which increases the risk of delivering the baby too early. In such cases, bed rest helps reduce the pressure on the uterus and cervix, giving the baby more time to develop. Usually, doctors recommend staying on bed rest until a contractions are under control, or at least until the pregnancy crosses 37 weeks, where the baby is considered full term. Number 2. Cervical insufficiency. A weak cervix or cervical insufficiency means that a cervix begins to shorten or open too early, often without pain or contractions. This can lead to a risk of miscarriage or preterm birth. Bed rest is recommended to reduce pressure on the cervix, and sometimes a cervical stitch called cerclage is also placed. In most cases, women with the conditions remain on strict or modified bed rest until around 36 to 37 weeks of pregnancy, when it is safer for the baby to be born. Number 3. Placenta previa. Placenta previa occurs when the placenta lies low in the uterus and covers the cervix partially or completely. This can cause vaginal bleeding and serious complications if not managed carefully. Bed rest in the case helps prevent excessive bleeding and lowers the risk of early labor. In many cases, mothers are advised to continue bed rest until the placenta moves upward naturally, which sometimes happens by the third trimester. However, if it doesn't move, bed rest may continue until delivery. Placental abruption. Placental abruption is a dangerous condition where the placenta separates too early from the wall of the uterus. This can cause severe bleeding and can even threaten the life of the baby or mother. In mild cases, bed rest is advised to control the bleeding and closely mother and baby both. The duration of bed rest depends on how severe the abruption is. In mild situations, it may last for a few days or weeks, while in severe cases, early delivery is often the safest option. Number 5. Preeclampsia or high blood pressure in pregnancy. Preeclampsia is a condition marked by high blood pressure, swelling, and presence of protein in urine. It can be risky for both mother and baby if not managed properly. Bed rest is recommended to help lower blood pressure, reduce swelling, and improve blood flow to the placenta. Depending on the severity, some women are advised partial bed rest, while others may need complete rest until delivery. Number 6. Multiple pregnancy, twins, triplets, etc. Carrying more than one baby puts extra pressure on the uterus and cervix, which can increase the chance of preterm labor. For the reason, women expecting twins or triplets may be advised to limit their activity or go on bed rest, especially in the later months. Sometimes doctors recommend modified bed rest from the second or third trimester until delivery to ensure the babies have enough time to grow. Number 7. Vaginal bleeding or unexplained. Sometimes pregnant women experience vaginal bleeding without a clear reason. This can be due to placenta previa, subchorionic hematoma, or other unknown causes. Bed rest is recommended in such cases to prevent the bleeding from getting worse. The length of bed rest depends on whether the bleeding stops and the underlying condition is resolved. In some cases, women may need to rest for just a few days, while in others, it may continue until the end of pregnancy. Number 8. Gestational hypertension or severe swelling. High blood pressure during pregnancy, even without protein in the urine, can be a warning sign. Severe swelling in the feet, hands, or face may be signal complications. Bed rest is often suggested to improve blood circulation and lower stress on the body. The duration can vary from a short period until the condition stabilizes to longer rest until delivery if the issue persists. Number 9. Fetal growth restriction or IUGR. Intrauterine growth restriction or IUGR is when the baby is not growing properly in the womb due to poor placental blood flow. Doctors may advise the mother to stay on bed rest, especially lying on the side, to increase blood and oxygen supply to the baby. Usually, this type of bed rest is recommended in the later months of pregnancy and often continues until delivery to give the baby the best chance to grow. Number 10. Premature rupture of membranes or water breaking early. If the amniotic sac breaks after labor begins, it is known as premature rupture of membranes. This condition can lead to infection or preterm birth. Bed rest helps lower the risk of complications by reducing physical strain. The duration of bed rest depends on how early the membranes rupture. If it happens close to full-term, labor is usually induced, but if it happens earlier, bed rest may continue until it is safe to deliver the baby. Number 11. Low amniotic fluid or oligohydramnios. When there is not enough amniotic fluid surrounding the baby, it can affect the baby's growth and movement. Bed rest is sometimes recommended to increase blood flow to the placenta, which may improve fluid levels. The duration of bed rest in such cases depends on how severe the fluid shortage is and may continue until delivery with regular monitoring. Number 12. Severe back pain or pelvic pain. Pregnancy puts a lot of strain on the body, and sometimes severe back or pelvic pain can limit a mother's mobility. In such cases, doctors may advise temporary or modified bed rest to relieve pressure and allow healing. This kind of bed rest is usually short-term, lasting a few days or weeks, and is not typically recommended for long periods unless complications are involved. So, you know the 12 major reasons why doctors recommend bed rest during pregnancy and how long it is usually required in each case. Remember, every pregnancy is unique, so always follow your doctor's advice for the best care. If you found this video helpful, don't forget to like, share and subscribe for more pregnancy tips and health information. Take care. Bye.